This is a positive paper stating about our common role in dealing with this disease, in helping patients, in developing research, and so on. Now, I think there have been situations, and the European landscape is so hugely varied, where lobbying and showing the health regulators or the minister what modern oncology should be like helps in allowing these structures to happen, possibly would help towards recognition, towards formal recognition of the profession where it hasn't yet been recognized. And we hope it will lead to a support in a just desire to provide optimal care, which in some instances may need a concentration of expertise in the people appropriately trained for that. I think that multidisciplinary cancer care should be a collaboration of different professionals. What perhaps is particular for medical oncologists is that medical oncologists have the accompaniment of the patient along a very long trajectory, from the presentation perhaps with operable disease, but sometimes also into follow-up, sometimes into progressive or recurrent disease, and so on. So I believe that the responsibility for medical oncologists is perhaps more important to be present at all stages on a patient's journey with cancer. When a decision needs to be taken, the different areas of expertise need to be taken into account. And what our paper states is that certainly what systemic therapy is concerned, an appropriate training in background of internal medicine, in understanding of certain disease pathogenesis and molecular changes that may be similar between different types of cancer, that an understanding of a use of a drug that possibly was licensed in a different indication and where medical oncologists may have experience is a very big benefit, advantage. On the other side, it's clear that the radio-oncologists have the highest level of expertise in treating patients with radiotherapy, and certainly surgical oncology is leading the way in looking at quality, standardization, and we would like to learn from them. So it's not pitching one specialty against the other. It's showing that we have to actually work together. And the big concern, and one reason why we wrote this paper, is that sometimes care for patients is fragmented. So the patient sees one specialist and then gets referred to the next, and then to the next, and feels that there is no continuity in his care, and perhaps the exchange doesn't take always place at the optimal time point. So establishing strong tumor boards with very experienced people in their own fields is exactly what ESMO tries to push for. Perhaps it's more important now to have this paper than earlier because of the new drugs that have become available. Some of them are oral drugs, and there is a temptation to think that these are simple to manage drugs and drugs that can be given by a variety of people. This may be true in some instances, but in some other instances it may not be true. The question is also, we understand so much more about cancer now than a few years ago, and there is an increasing complexity in understanding of molecular pathology, of options in imaging, and so on. So in this context, we're also looking in this paper at what the future is and what the future role of medical oncology is. And we're also making a statement of the contribution that medical oncologists may make not only to patient care in a multidisciplinary team and perhaps in research, but also politically at a national level in terms of lobbying for patients to get optimal care. We need to be aware of the fact that these new drugs that are very expensive cause severe constraints on some of the budgets that we have, and allocating them rightly is important. Our first step or goal would be that this paper is taken by the individual countries and placed and discussed in their relative context. We encourage its translation, we encourage its being used in oncopolicy at a national level, and we hope that similar statements will come from other societies. Certainly this is something that will evolve, and perhaps this paper needs to be updated in 5 or 10 years' time. The exciting thing about oncology and about our profession as well is that it is developing and evolving. So we would hope that there will be a need to update it and make it more current in a few years' time. For the time being, I hope it will be used in different contexts by different people to forward the aim of best serving cancer patients and best understanding how to deal with cancer as a disease.